Name's Harold Frazier. I'm chairman of the Cheyenne River Sioux Tribe. We, the Cheyenne River Sioux Tribe, is taking this coronavirus very seriously. Just yesterday, we had a meeting with the Indian Health Service, Tribal Health, the county governments, the schools, all the schools on the reservation, and we had that meeting to come up and find out what each entity is doing in preparedness for this virus. And one of the things that we found and learned, the best thing for right now, our best weapon is prevention. And how we have a strong prevention is we wash our hands. It's important that we keep our hands washed, and when we wash them for at least 20 seconds. Also, two, try to avoid crowds. Try to stay isolated as much as possible, especially around, don't go into big crowds of people. I think that is very important. We also, from that, we started developing a plan, and all this past week, we've been working on coming up with a medical plan, how we're going to deal with this medically if it comes. And right now, we have developed a phone number, 964-0563. If you feel you have symptoms or whatever, dealing with this virus, call this number, and you'll be sent and given the appropriate help that you would need, even if it's just to find out information or whatever. I think it's important to know that. Today we issued a declaration of a state of emergency for the Cheyenne River Sioux Tribe. We also got a travel ban on our employees, not only just the tribal employees, but also the BIA, IHS, and county government employees, that there will be no travel off the reservation for any type of business. We feel that it's important that we try not to have much contact with the people from the outside. With technology, we're encouraging our staff and all the other entities that we utilize it as much as we can. And I think that's important that today, with our families and stuff, to stay in connection. But like I mentioned, a phone call is probably at this time better than actually visiting with them, because you may have it or whatever. It's just important that we try to take every precaution necessary. In addition to this hotline that we formed, we also have a Facebook page, COVID-19. That's an area or a tool that we will be putting out information on, whether it's video or any type of information, updates, daily updates. That's a Facebook page you can look at. We're also going to be using our radio station, TP Radio, to disseminate, also to be on there to talk and give updates. And we have staff that we have designated that will be on there to provide any more information that we'd have. And before I turn it over to these ladies that have been working on developing a medical plan for us, I just want to say that as of right now, on the Cheyenne River Sioux Indian Reservation, there is no positive cases of coronavirus. There's none. And I think that's important to let the people know that currently right now there's none of it here. And at this time I would like to turn over to these young ladies to talk about our plan a little bit. So thank you.
Thank you, Chairman.
My name is Danetter. I am a registered nurse who works for the Tribal Health Field, Tribal Health Services. I am DON and Infection Control Disease Prevention.
And I'm Molly Longbrake, a registered nurse at Tribal Health. I work with Infection Control and Disease Prevention. The coronavirus, otherwise known as COVID-19, is a virus that produces symptoms similar to the common cold and flu. Those symptoms are fever, cough, sore throat, and shortness of breath. Now, about 80% of people will develop only mild symptoms of these. Those at higher risk for getting coronavirus or COVID-19 are those with multiple health issues, diabetes, heart problems, lung diseases. But with proper prevention, you can keep yourself safe.
As Molly said, the best way is prevention. We need to protect ourselves. We need to wash our hands, practice hygiene, clean our areas. We need to social distance ourselves for a while, stay away from large crowds. If you're elderly and sick, stay home. Don't go out in public. We're also asking if you need to be seen for signs or symptoms of the coronavirus that you call ahead. Call the ER, call your providers, explain what's going on. Call this hotline. This line is going to be manned by our nurses at Field Health, and we want to talk to you. We want to help sort out the problems and see if we can help you and get you in the right direction before you go someplace where you might be infected when you really didn't need to be there. That again, the number is 964-0536, so 0563. So please call us and we'll help you in any way we can.
Also too, there were some other things that we, as Chambers who tried took action. We're telling all nonprofit and volunteer organization is not to invite or bring in any outside help that usually comes throughout the year to help with different things on our reservation. We thank them for trying to come out and help, but we're asking at this time that they do not come. A lot of times we get volunteers from universities and in different states, and right now we are closing that down. So, you know, we thank you for trying to come out and help our people, but at this time we're telling you that you know you're not shouldn't be here. Another thing that we've done, I think, is pretty huge and is a good thing as far as prevention is in line with the state of South Dakota. We have closed all of our schools next week, and that purpose is to sanitize thoroughly all of our schools. But one of the things that we're going to be working through there is the school lunch program will continue on. That's something that we'll be working on. As a matter of fact, it's coming next week, Monday morning. I'm going to be meeting with the school administrators again to make sure and to see how we could assist each other, because I think it's important that we need to work together as a team to combat this virus. So I'll be having a meeting then, and I'll get more of an update on when or about these schools. Another thing that we did, the action we took, is that we're shutting down some of our programs to thoroughly sanitize our tribal office buildings. As you well are aware, that we're scattered across Eagle Butte, so it's going to take some time. We're also going to be looking at procedures. But however, we have essential staff that will be remaining in offices and will be continue to work and be there to provide the services for our members and for the people. You know, so I think that's important. But I know in life, you know, we have plans developed, but as we move forward with new updates, changes things, you know, we'll always have to be flexible to modify our plans to best not only protect but serve our people. But again, I'm going to say this number, this hotline number is 964-0563. If you think or if you suspect anything with coronavirus, don't hesitate to call that number. It is manned by health professionals 24/7. So it's important that if you feel you know, you need something, just don't hesitate to call that number. And like I mentioned before, that we'll be updating the people through our radio, through media, just the old-fashioned going door to door with information. So we'll just keep working and keep trying, and rest assured we are doing our best and we'll continue to do our best. And I want to also thank the people that have been involved with us, and I think that right now our local service unit, the IHS, and our tribal health is good partners. They're got a pretty good plan in place. I know they work well together, so I starting to feel more comfortable that we are here and we will be here to help in any way we can. With that, thank you, and be looking forward to providing more updates to you guys. So thank you.